Traditionally, we have tried to understand three key aspects with regard to new pathogens. First is, of course, trying to understand the pathogen itself in terms of how infectious it is and how it can cause disease. Secondly, we've also focused on trying to understand what we need to do in terms of the infectious disease response, then try to understand the public health measures that are important for us to be able to contain the spread of the pathogen. However, a recent study that we've published in the Nature, which was done together with the University of Edinburgh, has shown us a number of lessons that we need to focus on to improve the three response areas. We also need to understand the social environment within which the pathogen is going to be transmitted. We have also seen that with COVID, we cannot only focus on how well we are able to respond to infectious diseases. And I think the study has also shown that countries which are better prepared to respond to infectious diseases did not do as well as we expected them to do. And it's because COVID was calling for also investments that we have traditionally looked at as investments focusing on non-communicable conditions. We need to place a much stronger emphasis on understanding the social environment within which these pathogens are transmitted in the region. With COVID-19, we have seen that this significantly impacts the transmissibility. We also need to understand better the linkages that the pandemic or the pathogen is having with other conditions. Again, with COVID, we have seen the very strong linkages with diabetes, with hypertension, and other non-communicable conditions. We also need to think a bit differently about how we are investing in our health systems. We have traditionally focused our systems more on responding to infectious diseases, but the COVID-19 pandemic has shown us that we need to have much stronger investments, particularly around critical care or emergency services, which have traditionally been looked at as non-communicable disease kinds of interventions.